This lecture is from Chapter 16. If you watched the previous lectures from Chapter 15 on psychological disorders, then you got a good understanding of what the disorders are. But how do you treat those disorders? When you notice that there's some atypical behavior, thoughts, or feelings, how do you treat that? A quote I really like is, "Therapy can help you to understand your thoughts and feelings and to develop healthier ways of coping with them." We know that therapy is one way to treat psychological disorders. So there are two types of therapy. Psychotherapy, which is a psychological treatment that employs various methods to help someone overcome personal problems or to attain personal growth. There's also biomedical therapy. As we know, there are medications for psychological disorders and also medical procedures to treat psychological disorders. So first, let's take a look at the various types of psychotherapy. The first would be called psychoanalysis. Free association means the patient relaxes and then says whatever comes to mind at the moment. This is often thought of as what Freud did, free association. Also, dream analysis. We know that some therapists will analyze dreams. The concept of transference, that's when someone redirects their feelings about one person onto someone else. So during a therapy session, it usually refers to a person transferring their feelings about someone else onto their therapist. For example, if I have a male therapist, I might redirect my feelings about my father to him. This could be a positive or negative thing. It could be positive because it could allow me to work through my feelings. It could be negative because you don't want to look at your therapist as your father if you've had a very negative experience with your father, because then you're going to have a very negative experience with the therapist. Psychoanalysis is usually a very long-term therapy. It could be a lifetime or years of therapy. Another type of therapy is play therapy. This is often used with children, since they're obviously not likely to sit on a couch and recall their dreams or engage in talk therapy. So the idea is that children will play out their hopes and fantasies and traumas while using dolls, stuffed animals, and sandbox figurines. So a great way to do therapy with children, since again, as it says, we know children probably aren't going to sit and talk for 45 minutes about what's going on. There's also behavior therapy. A therapist employs principles of learning to help clients change undesirable behaviors. So rather than like a psychoanalysis perspective of digging deeply into one's unconscious, therapists with this orientation believe that dysfunctional behaviors, like a phobia or bedwetting, can be changed by teaching clients new, more constructive behaviors. So both classical and operant conditioning can be used to achieve behavior change. And if you remember, we discussed those types of learning in former parts of the course. So you can refer back to that to get more detail about classical and operant conditioning. So cognitive therapy, a form of psychotherapy that focuses on how a person's thoughts lead to feelings of distress. The idea behind cognitive therapy is that how you think determines how you feel and act. Cognitive therapists help their clients change dysfunctional thoughts in order to relieve the distress. They help a client see how they misinterpret a situation, which would be a cognitive distortion. In other words, they're distorting the way they think, and that might need to be reframed. And again, as I've said throughout the course, there is a connection between thoughts and behaviors and feelings. So a cognitive therapist would look at those thoughts mainly, and how's that affecting your behaviors and feelings, and how can we change those thoughts to have a more positive effect on your behaviors and feelings. So there's a combination. There's a therapy called cognitive behavioral therapy. Teaches people to challenge negative thought patterns and turn less often to unhelpful behaviors. These strategies can improve your mood and the way you respond to challenging situations. So obviously, this is very similar to cognitive therapy, but it does add a behavioral aspect. It perhaps employs classical or operant conditioning to decrease a negative behavior instead of just trying to change your thoughts and change that behavior. So the ABC model of cognitive behavioral therapy, just to look a little bit further at cognitive behavioral therapy, an activating event. Obviously, we experience an event that prompts how we react. This determines how we feel about the event and how we behave afterwards. And then there are consequences. This is how you feel or what you do in response to the event. So in cognitive behavioral therapy, you would want to change how you think about that activating event, what your beliefs are about that activating event. And therefore, that will change your behavior, what you do in response to the event. Moving on, there's humanistic therapy. The goal of that is to help people become more self-aware and accepting of themselves. It's non-directive, which means the therapist does not give advice or provide interpretations, but helps the person to identify conflicts and understand feelings on their own. So no advice is given. You just kind of lead the patient to developing their own understanding of what's going on and increase self-awareness. This includes unconditional positive regard, which involves not judging clients and simply accepting them for who they are. And in my opinion, unconditional positive regard should be a part of any therapy. Anytime you're doing therapy or working with someone, you should always withhold judgment and just accept them where they are. Moving beyond psychotherapy, biomedical therapy, as we discussed at the beginning, involves medication and or medical procedures to treat psychological disorders. Medication is probably the most common type of biomedical therapy. Some basic types of psychiatric medication. Most of you have probably heard of the majority of these. There is a class of antidepressants. There's also a class of mood stabilizers. There's a class of sedatives, or that would be for anxiety. Antipsychotics, which would be for things like schizophrenia, and stimulants, which would be for things like ADHD or ADD. So different classes of medications depending on the diagnosis. Electroconvulsive therapy involves using an electrical current to induce seizures to help alleviate the effects of severe depression. I know we have a very negative view of electroconvulsive therapy due to how it was used in the past. So just an important note, it's used very differently and done in a much more controlled environment these days. And it's rarely used and only in severe cases in which medication was not effective at all. And again, it's a much more exact and controlled procedure than it was in the past. So that's a little idea of how to treat psychological disorders, some basic forms of treatment. Thank you for listening, and let me know if you have any questions.